It means that by knowing the side of the probe, you can find the for example, the side of the image. For example, which place is the right of the body, which one is the left of the body. And if you find the right body, you know that this tissue is liver, for example. But if you find the left side of the body, you know that this is a spleen. So this marker help you to find a good or right position, right anatomic position of the tissues in the body. Okay, this is another application of this marker. But please pay attention to these three slides. In these three slides, I defined you the three region which I talked about previously. Okay, for example, if we have a strong reflection, the strong reflection shows by white dots. So white dots on the sonogram image represent the strong reflections. Which kind of tissue produced strong reflection? Diaphragm, tendons, and bone. And all these tissue and organs produced strong reflection. So we will see them in white dots under sonogram, and we call them hyperechoic. So hyperechoic, it means much or too much reflection. It means strong reflection, and we will see them in a white image. Okay. The second region, it's a weaker reflection. As I told you, it's like that 50-50 of reflection, not too much strong and not too weak. Too weak. So this is showed in gray dots, and most solid organs like liver, spleen, bladder, kidney are showed in sonogram in gray, and we call them isoechoic. So isoechoic, it means that not too strong reflection, not too weak reflection. And finally, the third region, which there is no reflection, called echo free or no reflection. And we will see these regions on sonogram in dark. For example, cyst, urine, and blood shows dark in the sonogram. And this region called hypoechoic or echo-free, and sometimes they called unechoic, echo-free, and hypoechoic are the same, and they shows that the no reflection or very weak reflection parts in our body like blood, urine, and cyst. Okay, you know that in diagnostic radiology, I'm sure before me, my colleagues teach you that in PET scan, in computer tomography, and in other kind of radiology imaging, you can use some specific drugs which can increase the contrast of the image, and we call them dye. Dye, it means the name of the non-toxic liquid which injected to the patients, and it can increase the contrast of X-ray image or ultrasound. So in ultrasound also we can use some drug for increase the contrast. As I showed in this slide, the upper image, it's a normal ultrasound without any dye or without any color or without any drug, and the lower image shows the ultrasound, the same ultrasound for liver, but by using a contrast. And you will see in the lower image, we have a better contrast, we have a colorized image, and we can see easily the 3 or 4 tumoral region in liver, which it's possible to see in the upper image without contrast, but it's a little bit difficult. So I want to show you also, like normal radiology in ultrasound, you can use some drug for increase the contrast of the images. And also, one of the important application of ultrasound is to measure the thickness of the liquid behind the neck of fetus, okay, or baby's neck. Look at the yellow marker I showed in the behind of the neck of the fetus. If you can measure this thickness by ultrasound, and you found that normally the normal thickness should be between 2.5 millimeter up to 3.5 millimeter. If this liquid thicker than this measurements, it shows the symptom of the Down syndrome. So by ultrasound before born the child, you can find this kind of disease. But you can see here, if you want to measure this thickness, you should put the probe in the right way, in the right direction. For example, you can put the probe along with 12 and 6 o'clock, okay? But if you put the probe on along with 3 and 9 o'clock, it's wrong way. For this reason, you should know that each ultrasound probe has a marker on one side, and you should pay attention to this marker when you want to take an image. Where is the marker position, okay? So this is one of the application of ultrasound. The third mode is M mode. I don't want to talk too much about M mode and real time. Just that M mode and real time are very very similar, because if you remember from yesterday, we told you that two types of ultrasound will be used in medicine: pulse mode and continuous mode. Pulse mode, it itself categorized in four mode: A mode, B mode, M mode, and real time mode. I explained A mode and B mode today, and I want to talk a little bit about M mode and real time. Please note that M mode and real time are very similar, and they are different with B mode and A mode. The big difference is in M mode and real time, we used a lot of small piezoelectric crystal in one probe. For example, 200, 250, 300, something like that. And also, we used a higher frequency or higher pulse rate in M mode and real time compared to B mode and A mode, because in M mode and real time, we would like to measure the motion parts of our body. For example, cardiovascular, fetal cardiac, or even adult cardiac properties. For this reason, the M mode, it means motion mode, and it means that you can measure the motion of the or moving body parts. So this is very important. I wrote in these slides that the high sampling frequency will applied in this mode about 1000 pulse per second, which is much bigger than much higher than the pulse that we used in B mode. And also, by using M mode and real time, as I showed in the slide number 14, you can measure the thickness, the diameter of the important valves inside the body. For example, in ventricle, interventricle septum, and mitral valve. And you can find that if the mitral valve has a leakage or not. If it's not completely closed or it's not completely open, we have a problem. By M mode, you can find this, okay? I know this is probably a little bit complicated, but for the moment, it's enough. Just that the M mode is for applied for moving parts in our body. The last mode is called real time mode. Real time mode is very similar to M mode. Just here we using real time to measure the flow of the blood. I means that the velocity of the blood, how much blood passed through from mitral, how much blood passed through from vena cava, how much blood passed through from the aorta, or something like that. So you can measure the blood flow in all the I don't know, in all the vessels, in all the arteries, or something like that. And this is very useful. You can find some stopped or some fat or lipid that stuck on the wall of the vessels, for example, an heart. You can find where we have a problem inside the vessels, inside the artery, or something like that. So this is very important mode. For example, in this slide, I'll shows that if you put the probe with a specific angle against the for example, against the vessel or something like that, or artery, you can measure the volume of the blood passed through to this vessel, and it's very useful. Don't worry about the complex image, but on the top of, excuse me, on the bottom of the image, you will see that by using the real time, you can measure the peak, and this peak, the area under the peak shows the volume of blood which pass through from inside the vessel. And you can measure, for example, how much blood will go inside the heart in systole or diastole period. And completely forgot the slide number 17. I don't want to ask you to memorize formula. This is just for the students of radiology, and just it's here how you can measure the flow of the blood by ultrasound. Forget it. And also, yeah, this is a nice slide, number 18. It shows that you can measure the velocity of blood during the systole or diastole period in heart, and also the peak shows the volume of the blood. And very important, slide number 19. By using real time, you can identify two important blood flow in our body. The first flow called laminar. Laminar, it means normal blood flow inside the vessels. In the normal, which I showed in the figure in the bottom of slide number 19, you can see the upper image shows the laminar, which in the laminar flow, the velocity of blood in the middle of vessel is higher than in the edge of the vessel. And this is a help to the cells which are living around the vessels to reach or catch enough nutrients, enough enzymes, enough, I don't know, blood, oxygen, CO2, or something like that. But the velocity in the middle of vessels should be higher, and we can know that the blood, it's like a different layer which slippery on each other, okay? But the middle layer moving fast than the other layers in the edge, okay? And the second flow which we can detect it by ultrasound, it's called turbulent. The the, 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 the bottom image, in the turbulent, it means that we don't have a normal flow. In some part of the vessel the flow is high, in some part is low. It's like a noisy flow. And noisy flow or turbulent flow, it shows that there is a problem inside the vessel. And by measuring this, we know that which part of the heart is it's stopped, or it's like blocked, and you should open it, okay? And in slide number 20, finally, the other mode of ultrasound in which applicable in medicine is continuous wave. And I shows that the continuous wave is just applied for broken the stone inside the kidney. It's like a treatment application, which I will talk about in the next few slides. Okay. Now we move to the application of ultrasound in diagnostic and treatment at the same time, and we have a very important process. This process called endoscopic ultrasound. Please note that endoscopic ultrasound, one of the most important application of ultrasound in medicine. For example, you know that, and yesterday I a little bit talked about endoscopic, normal endoscopic. In normal endoscopic, normally we used a visible light to see inside the esophagus, inside the mouth, inside the stomach, inside the small intestine, inside the long intestine, inside the lung. It's excuse me, inside the the bronch or something like that, or inside the bladder, and it's called endoscopy. I don't know, colonoscopy, cystoscopy, bronchoscopy, or something like that. But if you add a small piezoelectric crystal to the normal endoscopy, we have a ultrasound endoscopy. It means that you can put a catheter. Catheter, it's like a small tube which you attached a visible light and put it from the mouth to stomach, and we called it endoscopy. If you add a piezoelectric to this system, we called it endoscopic ultrasound. So what is the benefit of endoscopic ultrasound? You know that if you put a light inside the esophagus, you cannot see the light from outside the body. Yeah. And if you want to use the ultrasound to see inside the stomach, it's impossible. Can you tell me why? Does anybody memorize that why we cannot use ultrasound for see inside the stomach from outside the body? Yesterday I talked about that. Why ultrasound is not a good process to see lung, to evaluate lungs, okay? And what about stomach? Can you let me know? Can you explain me why ultrasound is not a good process? Can you hear me? Can you still hear me? If you can hear me, please let me know. Okay. So, does anybody can explain me why ultrasound is not a good option to see inside the stomach? Because in stomach we have air. So if you put the probe on the abdomen, the ultrasound can go inside the body, can go pass through the diaphragm, can go inside the stomach. You can see the first wall of stomach, but inside the stomach probably you have some gases from the I don't know, from the meat or digestion, something like that, or you have some air, so there is no reflection, excuse me, there is no ultrasound to pass through inside the stomach. For this reason, you cannot evaluate stomach from outside the body, but by using endoscopic ultrasound you can put the probe directly inside the stomach, so you are inside the stomach, and you can evaluate all the walls inside the stomach and something like that. So ultrasound endoscopic has a lot of benefits. For example, you can go, as I showed in a cartoon picture in slide number 22. In slide number 22, you will see the ultrasound endoscopic. It's very close to the, for example, a tumor lesion inside the esophagus. The ultrasound can attach to the tumor. It can measure the thickness by A mode. You can measure the thickness of the tumor. You can measure the thickness of the normal esophagus wall, and you will see if this tumor is invasive or attached or attacked to the esophagus wall, or it's if the tumor, for example, inside the stomach, attached or attack into the stomach wall. So it's very important. You will see in the right of the image in a yellow marker, you can measure the thickness of the tumor, and this is very important in kind of staging the tumor. And finally, another application, another important application of the endoscopic ultrasound is for evaluate your lungs, which we called it bronchoscopy ultrasound. In kind of bronchoscopy ultrasound, you will see on the image the probe is inside the bronch, and you can because ultrasound can come out from the tissue, it can evaluate the lymph node, but by a normal bronchoscopy, light cannot pass through, come out from the tissue, so you cannot evaluate the lymph node by normal bronchoscopy, but with ultrasound bronchoscopy, you can evaluate the lymph node out of the lung or out of the bronch system, and you can also biopsy, make a biopsy, because the endoscopic ultrasound or normal and ultrasound, all of them, they have a small needle for make a biopsy, and you can make a biopsy and you can evaluate if this kind of lymph node are tumoral or not. You will see the real picture of endoscopic ultrasound. You have a small piezoelectric crystal, which is like a convex in white. You have a small needle. You can make a biopsy. Also, you have a light, visible light, because it can bright inside the stomach for you when you want to go, when you want to take a biopsy. And also, you have some other holes in this endoscopic, like small holes for come out water for washing the wound, washing the bleeding wound or something like that. Or even you can put some drug on the on some specific wound inside the stomach. So it's very I mean that it's very professional method. And also, this is another important application of endoscopic ultrasound. The probe is go inside the stomach, and from the wall of the stomach on the, for example, pancreas, you can take a biopsy from pancreas. You can evaluate the pancreatid, or you can find some tumor inside the pancreatic part. Okay, and also, in this table, I showed some application of ultrasound in veterinary. You know that, as I told you yesterday, for the first time, ultrasound was introduced in veterinary, and after that, the people use that for human also. Most of the important application of endoscopic ultrasound for stomach is tumor staging. This is very important. It's for follow-up after radiation therapy, after chemotherapy, and also for identify gastric or in pancreas is very important for diagnostic and staging neuroendocrine tumors. You know that in our body we have a separate nerve system for stomach, for small intestine and long intestine, and this kind of nerve system or nerve network is called neuroendocrine. And sometimes we have some tumors in these parts which it's invasive to neuroendocrine system, and these tumors are very important, and one of the best way for identify them is using endoscopic ultrasound. And also for the other side, for the other part of our body, for example in thorax, in mediastin, you can use ultrasound, because ultrasound can come out from esophagus. It can go to inside the mediastin. The mediastin is the distance between heart and esophagus and something like that. And you can find if there is some tumor there, and they can move, or they can make a pressure on heart. Okay, in slide number 27, I want to talk about one of the important application of ultrasound in medicine, which is really important. These types of application is called sonodynamic therapy. But before talking about sonodynamic therapy, I would like to talk about photodynamic therapy. Do you remember yesterday we talked about photodynamic therapy? Does anybody remember that? If you remember, just let me know what does it mean, photodynamic therapy. Can anybody explain me what does it mean, photodynamic therapy? Okay, Please think about that and take a break. It's about 15 minutes or 20 minutes. I will return back and to explain the rest of the slides. Okay, just please little bit think about photodynamic therapy, because if you understand the mechanism of photodynamic therapy, we can explain you the sonodynamic therapy in a very simple way. I will return back, okay, in 15 minutes.